How are you feeling today, my lovelies? Of course, last night I had an event I went to for creators, a B&H event with Nikon as well. And that was wonderful. And I was there late. And of course, I have this live in the morning. I keep doing that. I keep going to events the night before and then having a live in the next morning. So of course I look like a crazy person. This is my outfit of the day. Woo! I hope you guys are all having an amazing, amazing day. Um, but today's live is obviously to say hi, but most importantly, I wanted to talk about a couple things to do with your gums and your gum health. Yeah, you know what? I've been using this lately and I'm realizing it's making my skin, I like it, but it's giving my skin a little bit of a glow. Um, I don't know. Do you like it? I don't know. Anyway, so as I do my makeup, we're going to talk about your gums. Hi, my friend. What is up? Where are you from? I'm in the New York City area. And today we're going to be talking about if your gums bleed. If your gums bleed and a few things that could mean and what you can do about it. Yes, it's so nice to see you, my friend. It's so nice to see you. So, what can cause your gums to bleed? Well, there's a few things that can happen that will make the body do that, okay? The first one, surprisingly, that a lot of people have made videos about this before and people are always shocked, is actually pregnancy. So, if you are pregnant, you may notice that your gums are really sensitive or your gums are bleeding when you floss or brush. And that is something that happens because of the hormones. The hormones in your body can make that happen. So a lot of times I will see patients that are pregnant and a lot by that point in time they already know that they're pregnant. But they're kind of shocked that their gums was so tender or that it was bleeding. That's something that happens because of the hormones. It can also happen, with hormones and the menstrual cycle. So that's another thing that can happen. Okay, so that can happen to some women. But what is some of the main factors that affect the gums bleeding? Okay, let's talk about that because a high percentage of the population actually have this situation going on and they're like walking around in life and they kind of have no idea, right? Because it doesn't hurt. It doesn't really hurt. It's a silent process, okay? And that would be gum disease, all right? So I'm sure you're probably saying to yourself, well, you know what? I don't have gum disease. No one's ever told me that. It's impossible or whatever, right? I have a mirror here, so if you see me kind of looking down to do my makeup while we talk about this, that's why I'm looking in the mirror. So there are different stages to gum disease. There's the reversible stage, the one where it's called gingivitis, where, as soon as you floss a lot, you brush a lot, and you get a dental cleaning, the gums are going to become healthy and tighten up again, okay? And that is the one that hopefully, if you have that, a lot of people are walking around with that, it can go right back to being healthy. The second one is periodontal disease, and that is where the bone that's holding your teeth in place have started to become involved, and that is being slowly destroyed, okay? It's an immune response by your body to all the bacteria that's invading it from the plaque and the tartar in your mouth, okay? And this is why your gums will also bleed. And your teeth might be sensitive or anything like that, but you might just notice, hey, I'm flossing and I'm bleeding on the floss. Or I'm brushing my teeth and when I rinse out and I spit, I notice that I'm bleeding, okay? So what else can cause our gums to bleed besides gum disease, pregnancy? Well, this one is actually a decent one. If you are brushing your teeth too hard, some people brush your teeth or floss really, really hard because they want to do a good job. And you ever heard that saying, like, too much of a good thing, right? So sometimes just irritation could be the reasons that your gums are bleeding. However, If it's irritated in one spot, that could be the reason. But if you realize that it's all over your mouth, it's all over the mouth, most likely that's not the reason, right? There's something else kind of going on. And if your gums bleed, by the way, that's not a normal situation, you guys. Go ahead and drop some hearts in the comments, or let me know where you're from, so I can see if you guys are actually hearing what I'm saying here. Yeah, but if your gums bleed, that's not really a very healthy situation, because healthy gums don't bleed. Your mouth is kind of like the rest of your body, right? Like your hands. Hi, Inna. What's up? How are you today? How are you? Where are you from? I'm in the East Coast over here. I'm in the New York City area, and it is 10 o'clock by me. And I just wanted to say hi to you guys and talk about what it is. What does it mean at a late night? What does it mean if your gums are bleeding? And we don't want that to be the case, right? So as I was saying, if your gums are bleeding, that's not healthy. Your gums are very much like the rest of you, but I love you too. Thank you for being here. I love you, and I hope you're subscribed. And if you have any specific type of content that you'd like me to create, or any questions about stuff you'd like me to make a video on, I can. Hi, Liz. How are you? Where are you from? I'm in the New York City area. Thank you for the heart. Thank you for the love. And today's live, I'm kind of just talking about reasons that your gums might bleed, and also what you can do about it. That part's really important too, because it's good to know what's causing a problem, but what do I do about it? That's important. You don't want to leave it like that, because that's, inflammation in the mouth, and inflammation in the mouth will lead to inflammation in the body, and we want to be healthy, right? Thank you for the love, Ina. I so appreciate the love. Mwah, mwah, mwah. You are absolutely awesome. Yeah, so like the rest of your body, your gums are in a situation where if it's bleeding, that's a sign generally that it's unhealthy for the most part. Thank you for the love so much. I love that. If you were to scratch your hand and it bled, you would say immediately, something's wrong, right? Well, that's really the same type of thing that you should be thinking when your gums bleed. I love this NARS. I love this NARS thing. I love this liquid blush. I love it, but it's not enough. It's not enough. I got to do a little bit more. Yeah, so definitely if your gums bleed, another thing that can be causing bleeding gums could be a vitamin problem. Okay, so some people are really low in like vitamin C or different things. It's not so often that we have that issue anymore, but yes, it can be a vitamin problem. Thank you for the love. Hi, Pedro. Hi, Pedro. I missed, you might have missed it earlier, but I mentioned that bleeding gums can be because of pregnancy. So if you have someone in your life or a person you know that their gums are bleeding, let them know. It could be pregnancy. It could be gum disease. It could be a vitamin problem. It could be brushing too hard. It could be a reaction. So some people have a reaction to the metal in their braces, and it's irritating their gums, or the dentistry is irritating their gums. So that could also be a factor. Yeah, I like this, but I'm not sure if I like the glow. Hey, thank you. Thank you guys all for being here. And today's live, I just want to kind of like check in on everybody and talk about bleeding gums. Hey, Crayon 2013. What is up? Where are you guys from? I'm in the East Coast. I make you happy? You know what? You make me happy. And is that a kitty face I see? I love animals. I have a cat and I have a bunny rabbit. And I really want to get a dog as well, because I love animals. I think that animals are the purest form of like love, and like they just give and give and give. And I just love my animals because they're so sweet and nice. Well, actually, my cat isn't always sweet, but I still love him. Yeah, I want to get a doggy. I want to get. I guess I will take anything, any breed I get, but I would love to get maybe a husky or a doodle or a retriever, a Labrador retriever or something like that. That'd be fun. But then again, I've been watching a lot of small dogs, but I'm completely distracted. But are you a vegan? So, great question. I am not a vegan, but I have been intermittent fasting, you guys. If you if you go to some of my old videos, you might have noticed that my face was a little chubbier because your girl loves to eat. This is just a fact. I love to eat, okay? I can't help it. I'm a little bit greedy. And so I tend to gain 10, 15 pounds ever so often. And so I slim down a little bit. I'm not vegan. I've just been trying to behave myself. That's really what it is. I've been trying to behave and it's worked and I've slimmed down like a good 15 pounds. If you guys want details on it, I'll give you my personal journey. This is not from a medical perspective. This is just what I've done. But a lot of it is intermittent fasting, giving myself a window to eat and eating healthy foods, vegetables and protein and stuff like that, and just like moving my body around. And but your girl loves to eat. I really do. Nice, thank you, thank you. Hi, Riley. How did I fast? Okay, so I give myself a window of time to eat. And usually it's between the hours of, I'm in the East Coast, so it's between the hours of 12, which is lunchtime, and 5. Once in a while I've cheated and I got home late and I ate something, but it was always just like vegetables and fruit. And I only eat during that time frame. I drink my water, I stay hydrated. If I have coffee, it's black coffee without, and this is not medical advice, this has just been my journey. I could go into more details about my journey with that. Yeah, someone told me intermittent fasting works. And I think within a 3-week time frame, I had lost like a lot of weight. Yeah, if you like, some of my old videos, you could see that my face was a little bit chubbier, and there's nothing wrong with that. There's nothing wrong with that. I just felt like a little sluggish, and I just wanted to pick myself up with a little more energy. Yeah, and intermittent fasting, you want to make sure that you talk to a doctor or provider or somebody before you start following anybody's thing, because I don't know what your medical health is. Yeah, so that's the thing. Like sometimes I go to work and people might be eating pizza or something. I don't cheat with that one. I try to move myself away from that one during this time phrase. But only if I'm going to, what I do too is if I'm going to an event and I know there's going to be delicious food there and I'm going to be involved, I will make sure during the day that I'm so good. I'm so good. And I'll move my window of eating to that time frame of when I'm going to that event. And I'll also try to make the best choices at that event. Whatever they have that are the best choices. So like, that's how I've been thinking, lately. So hopefully I don't fall off of this, because your girl cycles on and off of gaining weight, losing weight, eating too much, not eating too much. But that has nothing to do with bleeding gums. Yeah, and I appreciate you guys all being here. Mwah. I really, really appreciate you guys, and I absolutely love you guys. So what do you do if you notice, ooh, I'm putting blush up here and I'm kind of liking it. What do you do if you notice that your gums are bleeding? Thank you. I am beautiful. I appreciate you saying that, and you're beautiful for just saying that to me and just being kind and sweet and being a sweet spirit. I appreciate you saying that, because the internet is a wild place. You know what I'm saying? So what do you guys think you should do if your gums are bleeding? Well, the first thing you should do is you need to contact your dentist and your medical provider to make sure you're not pregnant. My smile made your day. Oh my goodness, I thank you so much for saying that. My goal is to really just put some light in the universe, give some information, and also put some light, and also have fun. Like, that's why I started going live, and I could connect with people more and chat with you guys, and answer any questions, and just kind of like have fun. There's so much going on out there in the world, and it's just nice to connect with good vibe people like you guys. You guys, I love you. Thank you so much for your positive energy today. I love that. I love that. Avalene, yes, Avalene, Avalene. I'm originally from Trinidad and Tobago, which is a tiny, tiny little island, you guys. It's small. And I came to America when I was pretty young, at 16 years old. And that was like my second time ever being in an airplane. And it was culture shock, and it was kind of crazy to look at my whole island from a plane. Like, whoa, that was my world? Like that just yeah. But that's me. I'm a Caribbean gal. I'm a Caribbean gal at heart. What is this saying? Yeah, so I'm not sure where anything is posted. You guys can look up my account, and I have a ton of videos on there. I have a ton of videos on there about a variety of things, from braces to oral hygiene to lip gloss, lip wear, and I use the same liner for my brows. And I don't know if this is bad or not. I use it for my lips. I totally use it to line my lips, because I'm gonna put some lip gloss there, and you guys will see how this is gonna come together. I'm a fanatic about cute lips. Okay, so if your gums bleed, and I'm just lining these lips here. If your gums bleed, you need to see your doctor, okay? Because they need to provide you with something to stop the bleeding gums. And in most cases, it's going to be better oral hygiene, okay? Brushing, flossing, eating your crunchy fruits and vegetables, things like that. Hi, Igor. Hi, Igor. Thank you for coming to my live. Yeah, eating your crunchy fruits and vegetables, water flossing even. Where are you from, Igor? Where are you from? Yeah, and in some cases, a deep cleaning. And I don't know if you ever heard the words deep cleaning, but that's when we scrape the root surfaces of your teeth and remove a lot of the tartar and the bacteria that's there. You're from Brazil. Brazil is in the house. Brazil is in the house. I hear a lot of Brazilian music and Brazilian beats, and I love it. I feel that stuff in my soul. That's pretty chill. That's pretty cool. I'm gonna put a little bit of eyeshadow on today. I've got this. I don't even know where I got this. I felt like I got this at some rando store, and I just like the color palette. The color palette is a mess. But but I'm gonna put a little something on my eyes. A little something. Yeah, the other thing that happens too, if you notice that your gums are bleeding and you don't address it immediately, it could be the first stage of gum disease that's easily reversible by going to the dentist and doing proper oral hygiene. And instead of you dealing with it now, it could progress to the later stages. The later stages might include getting deep cleanings from a dental hygienist like myself. It might include needing surgery, where they literally have to flap your gums back to clean out deep pockets. And you definitely don't want to get to the point where your teeth are starting to move or shift around, and eventually you're getting infections, because that can happen too. And as you swallow, what's up? What is up, my friend? Thank you for being here. I'm just gonna put this eyeshadow on. I like to put this little napkin right here when I do my eyeshadow, so it doesn't fall on my cheek. This is a cute trick I just learned. I kind of taught myself this trick. I have no idea. This is all self-taught makeup, you guys. And I hope in a few months when I do another live that I get better at my makeup, because that's why I'm doing it in front of you guys, because I want you to see my journey. I'm being honest about where I am in this journey. Hi, Hi, thank you for saying that. Mwah. Thank you for saying that. I appreciate you. Hello, princess. What a sweetheart. You guys are coming in today with the best vibes and just making my day. And I know I'm gonna go about my day and feel so happy and have such good energy. I really appreciate this. I really, really appreciate this. Now, one key to avoiding your gums from becoming unhealthy and needing surgery and your gums are bleeding and all that stuff would be to have a good healthy diet, right? And what does that look like? That looks like foods that support your mouth. That looks like things that are like hard cheeses. Hard cheeses are filled with calcium. That supports your mouth. Foods that are filled with omega-3s, like fish, that supports your mouth. Dark green leafy vegetables, those types of things support your mouth. Crunchy fruits and vegetables, things like apples, things like strawberries have malic acid in it, and that helps brighten your smile in general. So just organic food if you can, and natural food, not so much processed, that are crunchy, that's breaking off stuff. Pair that up with healthy beverages like water. We are grateful for your help. Oh my goodness. And I'm grateful that you're even here because, I want to have a good experience as far as I'm enjoying myself. So I'm here to share information and also enjoy myself. And I'm just happy that you're here and you're able to learn some stuff. And if any of you guys that are here, if you guys want wants me to make a video or you have a question about anything in particular, whether it comes to how do you keep your braces clean, how do you get whiter teeth, how to reduce bad breath, or anything teeth related or even makeup related, because I do a lot of makeup too now. If you have anything you want to see me try, if you want to see me try a certain brand of makeup, I'd be willing to go buy that makeup. Looking like a biscuit. I love biscuits. I used to eat, this is really bad. This is really bad. I'm going to say it though, because I'm going to be real. I used to love eating like those KFC biscuits with honey and butter. But that's so bad for you. That snack is so bad for you. I do like that nonsense, but it's not good for you. It's really not. And that was another reason why, I would gain weight and lose weight and gain weight and lose weight. So, intermittent fasting has really helped me. And actually, a patient of mine mentioned this to me and gave me this information. And that's how I started down this journey. You are so awesome, Lisa. Thank you. Thank you. Yeah, no, those biscuits are good. Those biscuits are really good, Some people like to eat them with gravy. I just like them hot with honey and butter. That's good stuff. But that's not the stuff that's good for your body. So everything in moderation, but I have a habit sometimes when I really like something, and you can ask the people that I work with. I have a habit, if I really like something, I will eat it day after day after day. And that's one of the worst things I think you could do, especially if it's a bad thing. Because I like it so much. I could go weeks just eating that same thing over and over because it's so good to me. And that's not good. So if I'm having tons of biscuits, that's not good. Yeah, that's good for the company, but not good for my overall health. Yeah. Yeah. So eating healthy foods is what's going to help you with your overall health with your gums and your teeth, and your body, as we were just like mentioning that, because your mouth is connected to your body. Your mouth is you subscribed. Thank you. I so appreciate you for subscribing. And if you have any types of questions about anything you want me to make a video on, or you want me to try a dental product, or you want me to try a makeup product, I'll go get that. We are what we eat. And you know what? It's so funny you say that, because I had a nutrition course in dental hygiene. I did. But I feel like they needed to go more. I feel like just in school in general, they didn't go as deep as they kind of should have, because we absolutely 100% are what we eat, because we feed those vitamins and those nutrients feed our body and give us energy, and they live inside of us. Some of them could stay there if it's certain fats or whatever, right? And if it's empty calories, you're going to be hungry again later and you're going to eat again. like McDonald's or whatever, which I love their fries, but I have to be like mindful that that type of stuff, if I eat too much of it, it's not good for me. So that's the thing, right? And then there's a lot of people sometimes around you eating those types of things, and you have to be strong. Like you have to be strong, But one of the things I do, especially like at work, is because I know sometimes the gals love to have their pizzas and their fries and that type of stuff. If I know that's happening, I find a healthy food that I love and I just absolutely love. And I'll take that to work because while they're eating that, I don't feel like I'm missing out and I can eat my healthy food and devour it, and that's not a problem for me. Like I love a rotisserie chicken. My kids hate rotisserie chicken, but I love a rotisserie chicken with like baked potatoes and vegetables. And that's a healthy meal that I could eat over and over again. And I love corn too. So certain things I know I absolutely enjoy, I'll just take that with me. So if people are eating the naughty foods that I crave and I want anyway, I won't like falter. At least that's my journey right now, and I hope I'm able to stick with it, because it's been really helpful. And I found that the intermittent fasting for me has helped me have a little bit more clarity. I wake up in the morning, I have 2 cups of coffee, and I don't eat until like 1. And that's just my journey. That's not medical advice. I don't eat until 1. Recently I was having breakfast. I used to have eggs in the morning because I love eggs. And now I'm trying to like go back and forth and again give myself a window where I'm eating. So if I eat in the morning, my window is going to be pushed for another time that I eat. And that's what I'm trying to do, to give myself the best mental clarity that I can have and stay as healthy as I can. You really love eating carrots with hummus. Oh, so I love hummus. So hummus is not something that's native to Trinidad at all. But I had it come into America and it's one of my favorites. So that's a great one. And when I go to Kava, which is this like Mediterranean type of fast food place, they have a mixture. They have like a red pepper hummus that I love. And then they have the regular hummus. Boy, when I tell you, I just love dipping veggies in that the same way you do. Or even like the pita bread stuff. I just love that stuff. Well, I love Mediterranean food. I adore it. I love the eggplants and all that stuff. Baba ganoush and all that type of stuff. Hi, Lisa. How do you heal inflamed gums without floss? So, do you know the reason? I'll start off with the reason why we floss. The reason why we floss is because, and let me put this down for a second. Say this is a tooth and this is a tooth. The way your teeth are in the mouth, they're almost like kissing each other. And your toothbrush cannot get between these places. So that means bacteria that loves to live without oxygen, that's bad, they grow a lot or flourish. So we pass floss between there to bring in oxygen to kill the bad bacteria. That's one reason. And the other reason is to remove extra food particles and plaque from between our teeth. So if you find it hard to mechanically floss, then the next option, according to the American Dental Association, would be a water flosser. The first option is regular floss. And then if you find that that's not working for you, even the one on the handles, then the water flosser would be the next option, okay? But I would try my best to floss. But again, if it's not working, water flosser all the way. I love the water flosser. I love the water flosser. What do you mean? I don't know if that's what I said. I'm not sure if that's what I said. I'll post this live so you guys could rewatch it. And I find my face has got such a glow to it. I've been using this e.l.f. You guys, e.l.f., don't sleep on e.l.f. e.l.f. is always making like versions of other types of, it's called Halo Glow. That's why my skin is glowing. So I usually have dry skin, you guys, and this e.l.f. Gives you a glow. So if you have dry skin and you want to look like you have a nice glowy complexion, use this. I didn't even read anything. I just went for like the one that I liked. My tooth bleeds when I eat hard food. So is it a baby tooth? Is it an adult tooth? if you are noticing any abnormal activity in your mouth, the first thing you need to do is call a dentist. Because if it's a baby tooth and that's happening, that can happen. That's all if it's getting ready to fall out. If it's an adult tooth, that absolutely shouldn't be happening. So you need an appointment with a dentist to evaluate what's going on here and why is this happening. Because bleeding isn't like something that should be normally happening in your mouth. That's something that you should be concerned about a little bit. What does it say here? Oh, she meant that someone else. I don't even know what's going on right now. Is it possible to reverse early signs of cavities in between your teeth with xylitol? Next level question, master question, huh? Yeah. So, short answer, yes. I'm not gonna be labeled that. It depends on if the cavity is called what we call incipient or very, very tiny and hasn't hit the second layer of your tooth yet. You can remineralize your teeth, but you need to speak to your dentist, and your dentist has to look at your mouth and determine what they want to give you to remineralize your teeth. So it's great to look at stuff online, and people might say, do this, do that. But every person is individual, and everyone has a history. And that's why it's important to tell your dentist, I saw this video online. Is this appropriate for me? Because your dentist might say no. Your dentist might say, no, I want you to use this toothpaste instead that has this to remineralize. Okay. So yes, it's possible to reverse or remineralize very, very small demineralized areas, but it cannot be a large cavity. If you have a cavity and it's called a full-on cavity or hole in your teeth, you're not reversing that. That has to be treated by a dentist. That has to be cleaned out, drilled out, and filled with a filling, my friend. So if you have pain on a tooth, don't wait. Go see your dentist. That's your mouth is in your head. Your mouth is right here. It's the first stage of digestion, right? As we put stuff in our mouth, it goes into our body. As you swallow, you're giving the stuff in your mouth access to your body. Right? So I think sometimes we don't think about that, right? But our mouth is also in our head. And our head, our brain and all that stuff, that's important, right? So it mightn't seem like anything too crazy, but it is, like, meaning as soon as you're concerned about something, call your doctor, because your doctor's gonna know, and that's gonna give you peace of mind, which is the most important thing. It's gonna give you peace of mind. Thank you so much. Oh, you're so welcome. Yeah. Still check your dentist. If it's a baby tooth, still check your dentist. And always, always, always call and schedule an appointment if something is bothering you. That's my go-to. If something new shows up in your mouth and you're like, whoa, this hasn't been there, don't feel embarrassed. Don't feel embarrassed and say, I don't want to go because I don't want to waste your time, or, this might seem silly. It's probably nothing. Go. Because sometimes it is something and we could do something about it early, right? You were eating crunchy food. Yeah. It's so funny because we always recommend that if a tooth is loose and you're eating crunchy food, that you should eat crunchy food if a tooth is loose and for it to come out. They prescribe you fluoride. Exactly. So sometimes if you think it's important, like the rest of the mouth might be something that you want to protect, we might recommend a prescription level of fluoride or something like that. Yes. Yeah, eventually when it's time for teeth to fall out, they fall out, especially if they're wiggly. And a lot of times if you go to the dentist and the dentist checks your teeth, they can decide if they want to help move that along or whatever. Yeah. It's so nice to see you guys. And I hope you know that bleeding gums is not something that should be a part of your life. And if it's a part of your life, you can get rid of it. You can get rid of it with watching your diet. You can get rid of it with brushing and flossing. You can use, if you go to my store, I have a store on my profile somewhere that will have a ton of products that I actually recommend for good oral hygiene, for brushing and flossing. The water flossers on there, the toothbrushes I recommend are on there, toothpaste, all that good jazz. The type of floss, because some floss has forever chemicals and you don't want that going in your body either. so I'm not a fan of that part. So I definitely picked the ones that I like, to help you guys out, and all the more to stay healthy. I'm gonna try and go live next. Maybe Saturday. I'm not sure. I have to look at the calendar. But I did a poll on my community tab, and I asked everyone, when did they prefer the lives, on Fridays or Saturdays? And most people asked for Saturdays. So my next live that I'm gonna schedule is probably gonna be on a Saturday. I'm gonna see how it works. I'm gonna see if people liked it and appreciated it and wanted to be there or not. And we'll figure it out and we'll go from there. But one thing I want to say is I'm so happy that you guys all came out and you supported me. And I hope everyone learned stuff from today. And thank you so much for